This video presentation was created to help both patients and healthcare professionals learn to visually estimate the amount of blood in a urine specimen. Blood in the urine visible to the naked eye is called gross hematuria. Hematuria is not normal, and its cause must be determined. Most episodes of gross hematuria are not due to life-threatening conditions or diseases, but some episodes are the only warning sign of a life-threatening problem. Very small amounts of blood can be visually detected in urine, and the amount of blood does not reliably predict the seriousness of the underlying cause of the hematuria. The presence of visible blood in the urine can cause fear and anxiety in patients and healthcare providers alike. Accurately estimating the volume of blood mixed in the urine can help direct treatment and eliminate unwarranted concerns of serious blood loss. Without a reference standard, estimating blood loss from hematuria is imprecise and without scientific basis. Simulated gross hematuria was mixed using freshly voided urine from a single healthy volunteer during various states of hydration and heparinized blood in variable amounts. Each clear urine specimen cup contained 50 milliliters of urine specimen and was photographed on white graph paper with blue lines. Several important variables affect the visual appearance of a gross hematuria specimen and thus impact the estimation of blood loss. The specific gravity or concentration of the urine prior to the addition of blood has a profound effect on its color. Dilute urine with a specific gravity of 1.000 has a clear appearance, and concentrated urine with a specific gravity of 1.020 has a light brown color. The transparency and color of the urine specimen cup, as well as the color of the background, tends to tint the urine specimen. The volume of blood added to the urine has the major effect on gross hematuria color. The next three slides demonstrate the relationship between urine color and specific gravity or concentration of the urine before the addition of anticoagulated blood to simulate hematuria. Each slide has the same format and displays 50 milliliters of clear urine specimen in a clear specimen cup with top and side views. The specific gravity of the urine before whole blood addition and the amount of blood added to each urine specimen cup are noted on the slide. The next 10 slides are photographic pairs of specimens utilizing the dilute, specific gravity 1.000 urine, with increasing amounts of added anticoagulated blood. Since specific gravity 1.000 urine is essentially clear, any observable color change is caused due to the addition of blood. Patients describe this specimen as, quote, clear tap water, unquote. Specific gravity 1.000 with 0.008 milliliters blood added. Even with the addition of a tiny amount of blood, the previously clear urine has developed a faint pink hue. Patients describe this specimen as, quote, barely pink, unquote. Specific gravity 1.000 with 0.017 milliliters blood added. The pink hue has become more prominent in the top view. Specific gravity 1.000 with 0.034 milliliters blood added. This hematuria specimen should never be considered normal. Remember, each sequential hematuria specimen has twice the blood added as the previous specimen. Specific gravity 1.000 with 0.068 milliliter blood added. This amount of added blood causes profound darkening of the red color. Remember, patients with gross hematuria are usually encouraged to, quote, drink more, unquote, or, quote, push fluids, unquote. So a specific gravity of 1.000 before adding blood is common. Specific gravity 1.000 with 0.125 milliliters blood added. The blue lines on the white graph paper are no longer seen on the side view of the specimen. Specific gravity 1.000 with 0.250 milliliters blood added. Patients describe this specimen as, quote, bright red, unquote. Specific gravity 1.000 with 0.500 milliliter blood added. The specimen takes on a dark shade of red as opposed to bright red. Remember, this level of gross hematuria accounts for only 10 milliliters of blood loss per liter of urine produced. Specific gravity 1.000 with 1.000 milliliters blood added. Specific gravity 1.000 and 2.000 milliliter blood added. The white graph paper with the blue lines has been almost completely obscured by the dark red color of the specimen in the top view. Bloody froth forms after mixing the specimen. The next 12 slides are photographic pairs of specimens utilizing unrestricted fluid intake, specific gravity 1.010 urine with increasing amounts of added anticoagulated blood. Since specific gravity 1.010 urine has a distinctly yellow color and semi-opaque light transmission, significant change of specimen opacity occurs with minimal added blood. Patients describe this specimen as, quote, lemonade, unquote. Specific gravity 1.010 with 0.008 milliliters blood added. No significant change in color occurred, but opacification of the specimen was noted, particularly from the top. Specific gravity 1.010 with 0.017 milliliters blood added. Opacity increased without significant color change. Specific gravity 1.010 with 0.034 milliliter blood added. Opacity increased without significant color change. Specific gravity 1.010 with 0.068 milliliters blood added. Specimen developed an orange hue. Specific gravity 1.010 with 0.125 milliliters blood added. Specimen developed a red cast to the underlying dark orange color. Specific gravity 1.010 with 0.250 milliliters blood added. Precipitous color change occurred in both views. The top view was dark red-orange in color, and the side view was dark brown in color. The white graph paper with blue lines was not visible. Specific gravity 1.010 with 0.500 milliliters blood added. The specimen became dark brown-red in color from both views. Specific gravity 1.010 with 1.000 milliliters blood added. Both views of the specimen became black in color. Patients describe this specimen as, quote, pure blood, unquote. Specific gravity 1.010 with 2.000 milliliters blood added. Both views of the specimen are black in color. Remember, be alert for the presence and quantity of bloody froth because the specimen color doesn't change. Patients describe this specimen as, quote, pure blood, unquote. Specific gravity 1.010 with 4.000 milliliters blood added. Both views of the specimen are black in color. Minimal bloody froth begins to form on the specimen cup rim with mixing. Patients describe this specimen as, quote, pure blood, unquote. Specific gravity 1.010 with 8.000 milliliters blood added. Both views of the specimen are black in color. Obvious bloody froth sticks to the wall of specimen cup. Patients describe this specimen as, quote, pure blood, unquote. The next 5 slides are photographic pairs of hematuria specimens utilizing concentrated specific gravity 1.020 urine with increasing amounts of added anticoagulated blood. Concentrated specific gravity 1.020 urine has a dark orange opaque appearance even before the addition of blood. Many patients and healthcare professionals confuse concentrated urine and gross hematuria, particularly in ill hospitalized patients. Patients describe this specimen as, quote, concentrated orange juice, unquote. Specific gravity 1.020 with 0.068 milliliters blood added. Only a slight darkening of the orange color occurred. Specific gravity 1.020 with 0.125 milliliter blood added. Slight further darkening of the orange color occurred. Specific gravity 1.020 with 0.250 milliliter blood added. A color change occurred with the top view of the specimen turning light brown in color, but the side view remained relatively unaffected. Specific gravity 1.020 with 0.500 milliliters added blood. The color of the side view became dark brown. Although bubbles appeared on the surface of the specimen, no true bloody froth developed. The Hematuria Reference Chart, HRC, developed at Michigan State University College of Osteopathic Medicine, sequentially displays each gross hematuria specimen used in this presentation. A hematuria specimen containing an unknown volume of blood can be matched to the hematuria reference chart to determine the volume of blood in the specimen. The chart can also help determine the specific gravity of the urine before the addition of anticoagulated blood. Row A of the hematuria reference chart, HRC, includes hematuria specimens made from dilute, specific gravity 1.000 urine, and the no blood added urine specimen occupies space row A, column 1 on the HRC. Row B of the hematuria reference chart, HRC, includes hematuria specimens from the unrestricted access to fluids, specific gravity 1.010 urine, and the no blood added urine specimen occupies space row B, column 1 on the HRC. Row C of the hematuria reference chart, HRC, includes hematuria specimens made from concentrated, specific gravity 1.020 urine, and the no blood added urine specimen occupies space row C, column 1 on the HRC. A few examples of possible clinical situations have been prepared to provide self-evaluation. Example 1. A hematuria specimen containing an unknown volume of blood has been presented for evaluation. How much blood does the specimen contain? Knowledge of the patient's hydration state at the time of the gross hematuria episode helps determine the specific gravity of the urine. The patient has been dieting and consuming 128 ounces of water per day for a week. Before proceeding in the evaluation of the patient's gross hematuria specimen. Make sure the urine specimen cup is clear plastic and contains only 50 milliliters of specimen. A white graph paper background with blue lines assists differentiation of opacity and tinting. The general color of the hematuria specimen can also help assure that the correct hematuria reference chart row has been consulted. Observe the hematuria specimen for evidence of bloody froth or foam, which appears with increased blood loss. Use both views of the urine specimen cup to improve specimen/hematuria reference chart matching accuracy. The patient's urine would be expected to be dilute in this scenario, but another important clue regarding urine-specific gravity can be seen. The patient's hematuria specimen is pink, and only dilute urine produces pink hematuria. The most likely match for this patient's hematuria specimen will be found in the top row A of the hematuria reference chart, the HRC. The unknown patient hematuria specimen matches the hematuria reference chart for photographic pair specific gravity 1.000 urine with 0.034 milliliters added blood. The total volume of whole blood loss for a patient can be calculated by dividing the voided volume by 50 and then multiplying the result by the amount of blood added to the reference cup. If the patient voids 500 milliliters of hematuria, take 500 milliliters divided by 50, and that equals 10. 10 times 0.034 milliliters equals 0.34 milliliters total whole blood loss per 500 milliliters void. The formula is the voided volume divided by 50 multiplied by the amount of blood added per specimen cup equals the total whole blood loss in milliliters per void, or simply consult Table 2. Example 2. A possible future clinical scenario. You are about to sit down for dinner with your family when you receive a panicky phone call from your old college roommate. He reports, quote, peeing out blood, unquote, and wants to know if he is dying and should go to the emergency room. His fear and concern are understandable, as last year he was diagnosed and treated for bladder cancer. You recall a hematuria reference chart was developed at Michigan State University College of Osteopathic Medicine. A Google search for, quote, hematuria images, unquote, on your smartphone locates the needed chart. Luckily, your friend has an extra urine specimen cup from his post-op cancer surgery visit. He agrees to send you top and side views of his hematuria via smartphone. Within moments, your smartphone receives the following photographs. The photographs are immediately concerning to you. The hematuria specimen is nearly black in color as viewed from the top and side. Thick bloody froth clings to the clear plastic specimen cup. After consulting the hematuria reference chart on your smartphone, it becomes obvious that at least 16% of the hematuria specimen is composed of whole blood. Your friend's hematuria specimen matches the hematuria reference chart for photographic pair, specific gravity 1.010 urine, with 8.000 milliliters added blood. Although it is nearly impossible to bleed to death from hematuria with an intact bladder and no urinary catheter, you send your friend to the hospital due to the risk of acute urinary retention secondary to blood clot. The online availability of the Michigan State University College of Osteopathic Medicine hematuria reference chart enables patients and healthcare providers to quantify and document hematuria. Even when patients don't have online access to the hematuria reference chart, they can photograph their hematuria specimen using a smartphone and send the pictures to their caregiver for comment. Urinary blood loss can now be tracked over the duration of a disease. The Hematuria reference chart is both an educational and diagnostic tool with documentation capabilities. This video, presented, titled, quote, Visual Estimation of Blood in Gross Hematuria, unquote, by David Don Wardinger, D.O., J.D., has been posted to YouTube. The Michigan State University College of Osteopathic Medicine Hematuria Reference Chart, MSU-COM-HRC, and all photographs of the other hematuria specimens and charts are available online.